Hello and welcome everyone. Today we are discussing about tuberculosis. In this video we are going to discuss about etiology, risk factor, symptoms, pathophysiology, diagnostic test, histopathological examination and management aspect of tuberculosis. Etiology. Tuberculosis is caused by Mycobacterium tuberculosis. M. tuberculosis is an alcohol and acid fast bacillus. It is a non-spore forming, non-motile, obligate, aerobic, facultative, catalase negative and intracellular bacteria. Risk factors for tuberculosis are following. First is socio-economic factors like poverty, malnutrition and wars. Second is immunosuppressive states like HIV infection, chronic immunosuppressive therapies like steroids, monoclonal antibodies, a poorly developed immune system in children and primary immunodeficiency disorders. Third is occupational risk factors like workers in mining, construction workers and pneumoconiosis or silicosis. Symptoms. There are two types of tuberculosis mainly. First is pulmonary and second is extrapulmonary. The symptoms of pulmonary tuberculosis are cough, hemoptysis, night sweats, low-grade fever, weight loss and weakness. The symptoms of extrapulmonary tuberculosis are night sweats, low-grade fever, weight loss, weakness, pain at site of infection and symptoms related to organ or site that is affected. Main extrapulmonary organs involved in tuberculosis are liver, intestine, lymph node, reproductive organs, central nervous system, bones mainly vertebra, skin, kidney and spleen. The pulmonary tuberculosis has two distinctive features. First is ghon's focus and ghon's complex. They are visible on X-ray. Let's learn the primary tuberculosis. The first contact of Mycobacterium organism with a host lead to manifestations known as primary tuberculosis. This primary TB is usually localized to middle portion of lung and this is known as ghon's focus of primary TB. A secondary TB occurs in most people who develop tuberculosis after a long period of latency, usually several years after the initial primary infection. This is known as secondary tuberculosis. The secondary tuberculosis usually occurs because of the reactivation of latent tuberculosis infection. Now let's learn what is ghon's complex. The pulmonary lesion of ghon's focus plus regional lymph node involvement together makes a ghon's complex. The pathophysiology of tuberculosis. It is a cell-mediated delayed type 4 hypersensitivity reaction. By stimulating the immune cells like helper T cells and CD4 cells, Mycobacterium tuberculosis induce a recruitment and activation of tissue macrophages. This is responsible for delayed hypersensitivity reaction. Two main changes involving macrophages occur during this process, namely the formation of multinucleated giant cells and formation of epithelial cells. Epithelial cells are modified macrophages and have a flattened shape rather than globular shape, and epithelial cells often coalesce together to form a giant cell in tuberculate granuloma. The appearance of granuloma in tuberculosis has been described as caseous or cheese-like on gross examination. The diagnostic tests for pulmonary tuberculosis are Montague's test, sputum examination, IgRA, interferon gamma releasing assay, X-ray, culture, CB-NAT. It is cartridge-based nucleic acid amplification test and PCR. The diagnostic tests for extrapulmonary tuberculosis are Montague's test, IgRA, CB-NAT and PCR. Now let's learn a procedure of sputum examination which is AFB staining or Zell-Nielsen staining. Take a glass slide and clean it with a gauze piece. Prepare a thin smear from the sputum and fix it at 80 degrees centigrade for 15 minutes. After that, put an absorbent paper on a smear and saturate it with a carbol 15. After that, heat under slide until the steam appears for approximately 5 minutes. After that, wash with tap water. After washing, add a decolorizing solvent. Again wash with tap water and add methylene blue counter stain for 20 to 30 seconds. Wash with tap water and let it dry and observe under the oil immersion lens. This is the reporting criteria by WHO for AFB slide after the ZN staining. In the histopathological examination, the characteristic of tuberculosis is a granuloma. The defining feature of granuloma are caseous necrosis, epithelioid cells, and multinucleated giant cells and surrounding lymphocytes. Now let's learn the management of tuberculosis. The recent treatment which is given by WHO, that is 4-month TB treatment regimen, consists of high dose daily rifampicin with moxifloxacin, isoniazid and pyrazinamide. In this regimen, 2 months is of intensive phase and the rest is of continuation phase. And another regimen is 6 to 9 month ripe TB treatment, which is a usual treatment which is already established since years. In this treatment, the medications include rifampicin, isoniazid, pyrazinamide and ethambutol. In recent years, the resistance to TB medications are rising. The MDR-TB. What is MDR-TB? The resistance to multiple anti-tuberculosis medication, including at least 2 standard anti-tuberculosis medications, that is rifampicin or isoniazid, is required to make a diagnosis of MDR-TB. Second is XDR-TB. A diagnosis requires resistance to at least 4 anti-tuberculous medications, including resistance to rifampicin, isoniazid, and resistance to any 2 of newer anti-tuberculous medications. So this is in short about tuberculosis, and these are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.